My name is Kyla Bowen. I am a nurse manager at the J.D. McCarty Center. We are a rehab hospital for children with developmental disabilities. We're located in Norman, Oklahoma. We see patients from birth to 21 years of age. I worked as a direct care specialist for about 8 years while I completed my nursing degree. Once I received my license as a registered nurse, I went into labor and delivery, stayed for about 11 years, and then decided it was time to look for something different. I was getting close to completing my master's degree in nursing administration, so I started looking for opportunities under that nurse administration role. I found that the J.D. McCarty Center was hiring for nurse managers and thought it was a perfect place to come back to. I loved my time here as a direct care specialist. It really was one of the driving factors that got me into the nursing field to begin with. I love that nursing has the ability to, you get your technical skills and you're doing a lot of hands-on things, but then you're also doing a lot of education for the patients and their families, and I loved that atmosphere and that part of it too. So I just thought nursing was really versatile and I could use it in many different things, and even within that I get to do a whole bunch of different things throughout my day.
If I was to sum up direct care, you're their best friend, really. You get to do everything with them, help them get ready, go to school, go to therapy, you can get to go to the movies with them if you're lucky. It's a really fun job. So what's great about working here is that any certification you need, they'll usually work with you to get it. CPR, first aid, stop the bleed, all that stuff. I learned it in my first week of being here at J.D. McCarty. A day in the life here at J.D. McCarty is you come in, you check your assignments, you take report, then you help get your patient up, you do their ADLs, you get to help them brush their teeth, get ready. If they have appliances, you help them put them on. Then you make breakfast and serve it to them or help them eat it. And then you get them ready to go to school, and they get to go to school and have fun, and that's just a great thing. And throughout the day they have therapy, so you get to help get them to therapy and back, and the doctor's appointments, and really just be their best buds. If I could give someone one piece of advice for getting into the healthcare field is be ready to be unready and get ready to get dirty.
So at J.D. McCarty, you can start here with just having your driver's license and being 18 years of age with a high school diploma or a GED. And with that, we love having, students in college that want to further advance their career. We have several DCS that started as a DCS and now are LPNs. And then we also have staff that are DCS and then they transition into a lead DCS role or even an RBT. So we have a lot of room to grow here at J.D. McCarty. We also offer a lot of different schedule agreements to work with your school, and we have a lot of flexibility so that a way we can work with you while you are in school. Teamwork is really important here at J.D. McCarty, whether it's taking patients to and from therapies, working with patients that are having a difficult time. If people see that you are struggling, being able to jump in and help is really important here. It really takes a special person that is super caring and likes working with kids just to make that day go by quicker. We have 5 hospital units and there are 6 patients in each hospital unit, and there's about 4 to 6 staff each shift. So it's a small unit in each hospital unit, so that's why teamwork is really important.
My name is Adriana Esparza, and I'm the lead direct care specialist here at J.D. McCarty Center. I started my role here at J.D. McCarty Center as a direct care specialist. You have to have your current driver's license, your high school diploma, and then I was in my direct care specialist position for a little over a year until I got promoted to the lead direct care specialist. And basically, if you have your CNA, which is a certified nurse's assistant certification, that helps. It's not required, but it does help to have that to become a DCS here at the J.D. McCarty Center.
At 16, I got my certified nursing assistant certification, and I came here a few years later to be a direct care specialist. And I did that for a few years while I was in school to become a registered nurse. Halfway through my registered nurse program, I tested to get my licensed practical nurse. And 6 months later, I graduated as a registered nurse. Teamwork is one of the most important things in healthcare, especially at this job. Our whole entire day, everything involving the children, all revolves around teamwork. We work as one big team to provide for these kids, whether that be through communication, to meet basic needs. Everything we do is as a team.
My best advice to people who want to go into the medical field in general is just to be flexible. Make sure that you're dedicated to continuing your education throughout your career, because things are always going to change. You're always going to need to get up to date on the new findings and just really stay involved and engaged.